Dr. Paul again. Welcome to my clinic, and I want to show you part 3 of doing the shoulder. I mean, this is basically tailored to each person that comes into the office. This gentleman basically is having, stiffness and pain through the left shoulder, also through the neck area. But as you can see, we cupped him right here, okay, which is kind of like a form of acupressure, and we're going to actually tape him to reduce muscle spasm. Okay, so as I muscle test him, this is something you're not going to do at home, but generally you're going to either place a tape going down this way or going up. In this case, I'm going to do up, and if you're at home, you're going to have to try both to see what you get a better response with. So in this case, when I start here and end up here, it starts to pull the tissue down here on both sides so that it reduces muscle spasm. Okay, so just kind of estimate. Generally, I've been pulling it about 40%, a pretty good stretch, in order to get more of a pull. Okay, and so I'm going to do probably 3 squares on this one because it's not that long. I like to attach it all the way to the top where the shoulder attaches, right where this bump is. There's the clavicle right there, and as it goes over the hill, then you get another hill, small clavicle bump right there. I'm going to do right to that point because that's where the shoulder ends. So I like to cover the joint. So I'll probably do 3.5. Let's do 3.5 squares for both of them. Okay, so I'm cutting 3.5 squares. And then remember, when you're pulling it, when you're tearing it, you're tearing the ends. For this is called a spasm correction. And I started down here, and I wanted to end up here. So he's going to stretch his muscle out, probably in this direction right here. This part he's going to stretch it this way like that, and the other part he's going to just stretch it back like this, because you want to stretch over the tissue in the direction that that allows him comfort with movement. So I'm going to take the tape off, put tape right here, and I really get a good rub it good so that it heats it up and then sticks better that way. Now remember, don't rub it up this way. So I'm noticing that there's a peel right there. I mean that the corner is lifting up. You don't want that. It's going to start peeling off. So I'm going to put additional tape on there just to protect it. So now he's going to pull the elbow across his stomach. Oh, let's see, it came off. So it looks like we're going to have to do a little bit of adhesive. So I'm going to use this right here. And then in this case, I don't want it to spray all over the place. So I'm just going to put it with a towel into the towel like this and just spray a couple times. Okay, that way it won't spray all over the place. And I'm just going to just put it right there. Right where it's going to go front and back. On the top to bottom, I'm sorry. So that'll give a little bit of a tackiness and adhesive on there. Okay, good. Get another piece of tape. Let's try that again. Okay, rip it right at the edge. Don't lay down on the bottom of this part. The skin must have been oily right there, and so that's why I did that. See, now it's sticking better. And then you at the end, when you roll it over, you kind of like lift up so the tape comes up, the paper comes off. Then pull it all the way to the edge, so there's about a ½ inch to an inch of that you're holding onto. He's going to stretch the elbow across this bend the elbow. That's it, good. And stretch it across like that. Good. Now I'm going to lay it down at a 40% stretch, then lay it down right over the shoulder. Okay. Sorry. I need to hack you in the neck there. And then, so there's one tape. Next tape, same thing. Okay, tear it at the edge here. And then you're going to go over the other side. This is the one he's going to stretch over the deltoid. I'm going to put it right over here. And I rub it. Remember, heat activates it and makes it stick better. We lift off the paper, pull it back all the way, and then he brings. I'm gonna put a tape over this. And bring it back. No, actually forward and then just bring it straight back like that. Good. Now I'm gonna hold down. I'm gonna hold it down. You don't want this wrinkle right here. So, okay, relax now. So now, he's got it over the shoulder. And because this is lifting up, I'm going to put a little piece of tape on there. Just going to use the old one. And I'm just going to tape it over. This one I'm going to tear it in the center. And just put it over this. So what I do with a center tape, now there is a correction for this, but in this case I'm just doing it to hold it down. I tear the paper off and stretch it like this. And I put it down right at the edge here. So I don't care if this comes off. I do care if the one underneath comes off, because then it's going to start peeling and then you're not going to get the correction. So that's how you do the shoulder for this particular type of pain. I always tailor it to what the person needs, but in your case at home, you can do a full shoulder thing. You have to try, experiment on different directions of, whether to start it here or start it down here. I started it down here to reduce muscle spasm. So a general rule of thumb, if you're spasming in your muscle, then you want to do this. If you're weak in the muscle, if you feel there's a weak issue, you would go the opposite direction. Okay? The opposite direction also controls lymphatic drainage. So if someone has like inflammation, you don't do it as much of a stretch, but you just start up here, but you just do a little bit of a stretch and then place it down. And that drains the fluid. So like I said, lately I've been just doing more of a harder pull, and I just sprained my ankle over the last weekend. A couple of days ago, in fact, I heard a crack. I was going on a trail, and then I was carrying my baby, which is up front here, and I wasn't wearing good shoes, hiking shoes. Next thing I know, just one little tiny misstep, and boom, I sprained my left ankle. Well, immediately I put some ASEA gel, which is another, it's called Renew 28, that helps heal the tissue, and then I put Kinesio Tape right away on it with about a 40% stretch. And today, by the end of the first day of wearing the full day of Kinesio Tape, so day 1 was at night, I put the Kinesio Tape on. Day 2, I wore you wear it for 3 days, the tape. By the end of day 2, I felt like, wow, I can walk on this normally almost. And day 3, I feel around the inflammation, it's almost all gone, the inflammation. And I heard it crack, a pop. So I was wondering, okay, did I tear the muscle, the tendon really bad in my ankle, So it's doing good. So as you take that tape off, you'll notice the bruising, which I had bruising, I could tell right away, that the bruising will just completely fall off or just be drained because I'm draining all the lymphatic tissue from that area, all the inflammation. And so Kinesio Tape is a really good tool. It's easy. You can buy it on Amazon. And the hardest part is, know how and where and which direction to do it. But, at home, you can just experiment on that. I'll see you next time.